Good afternoon, class. My name is Rhonda Taylor, and I chose to do case study number 92, and it is on acute streptococcal pharyngitis. My patient is an 11-year-old girl. Her initials are SJ. She's been ill times 3 days with a sore throat, a temperature of 102.3, chills, and pain while swallowing. She's had a poor appetite, but she has steadily increased and kept her fluids going within the last 48 hours. She has no headache, no rash, no vomiting, no nausea, no stomach pain, no difficulty with her breathing. She has no joint pain and no cold symptoms. However, strep has been going around her school for the last 2 weeks. Clinical signs that led to the diagnosis of streptococcal pharyngitis was she had the fever, the chills, solemnness, which is an increased desire to sleep. She's anorexic, which can relate to loss of appetite. Leukocytosis, which is an increase in her white blood cell count. She's lethargic, which is like basically no energy, just lays around. She's had an increase breakdown of muscle proteins, muscle aches, and she has an increase in erythrocytes sedimentation rate, which is her ESR, which was determined through her blood lab results. The major risk factor for acute streptococcal pharyngitis is when a person is infected with it, coughs or sneezes, then the tiny droplets can be spread to other people by way of air. So you want to have airborne precautions. It can also be picked up that way by many different types. There's C, F, and G, which are associated with foodborne outbreaks, and then we have especially with the milk and milk products. Then you have strep bacteria, which can be picked up from infected nasal secretions, like when somebody sneezes, grabs the doorknob and or saliva and that does it that way. Or if you kiss somebody that's got the cold or the infection, different utensils around the house, bathroom things like the doorknob on the bathroom door, the counter, the cabinets. Sharing a toothbrush, yeah, pretty gross, huh? But yeah, using a toothbrush you can also transmit that way. The drugs of choice would be an antibiotic, especially in the penicillin families. That way, it's a strong antibiotic that'll kill anything. Unless you're allergic to penicillin, then you want to do maybe Keflex or something on that order. And then you also want to use an anti-inflammatory like naproxen to keep the swelling down. What kind of heart disease is related to something like this? Heart failure due to or secondary to rheumatic fever, which causes a decrease in the renal function from glomerulonephritis. You get organ failure from toxic shock syndrome and bacteremia with the infections occurring in other organs and so on and so forth. Some questions that were brought to my attention from some different people were, why are only 3% of the patients with unrelated acute streptococcus pharyngeal develop rheumatic fever? Well, it develops in 3% of all cases of untreated ASP because of the episodes of strep throat, may cause joint pain or permanent injury to the valves of the heart, which will cause heart failure. And the rheumatic fever can be followed months by Sydenham chorea, a neurological disorder in which temporarily causes a jerky movement developing in the arms and legs, kind of like Tourette's, maybe on that order. the loss of proteins from the circulation, causing the development of edema during the inflammatory response, is because of the liver is the major organ targeted due to the ketones induced in the liver, which releases a certain number of proteins and collectively referred to as acute phase proteins, which is circulated in the blood. And when somebody has this, the C-reactive protein, which is plays the major role in controlling the inflammatory process, it prevents the excessive damage to the healthy tissue, facilitating the white blood cells. Medications like aspirin, ibuprofen, naproxen are easily effective in temporarily relieving discomfort and pain from this because it's an anti-inflammatory and a pain reliever. The antibiotic, the penicillin that you want to be taking, which is supportive care, and it prevents the ibuprofen, and that prevents dehydration. A 3-year-old who develops a sore throat and low-grade fever several days after coughing, sneezing, and the rhinorrhea, it is acute streptococcal pharyngitis. Maybe, maybe not, because the onset of the fever is usually 101.5 to maybe 106. It peaks on the second day with sore throat, pain, swelling, tender swollen lymph nodes in the neck, malaise, headache, nausea, and vomiting too. You're usually considered contagious between 7 and 9 days. And usually before, by the time you've got it, you've already contaminated pretty much everybody within distance. Can you get strep throat even if you don't have tonsils? Yes, you can. I'm living proof of that because I don't have tonsils, and you mention the word strep throat and I've got it. So you got to be really careful with that too. Predominant white blood cells. What type of peripheral blood of patients with acute pharyngitis? The CBC will reveal leukocytosis with predominance in the neutrophils in the peripheral blood. You don't want to treat young children with aspirin because you can end up with Rye syndrome, which is very toxic and fatal in young children. Antibiotics should not be given to persons with a sore throat before diagnosis of the acute pharyngitis because you want to make sure you have a positive culture before you do that, because if you give it to them before, you may be trying to treat something other than what they have. So I hope that information helps. Have a good evening.